What is acute intestinal obstruction? Symptoms, types, treatment and diagnosis. Interesting about science and medicine. Prepared by the editors of the page or scientific. According to the clinical course, acute and chronic intestinal obstruction is distinguished. Acute intestinal obstruction is more common than chronic. The latter is a consequence of a long-term disease of the intestinal wall, of a mesentery of the intestines and its vessels and nerves, as well as any congenital conditions. Chronic intestinal obstruction develops over several weeks or months until it suddenly becomes acute. Acute obstruction is a dangerous disease, since irreversible change in the body develop very quickly, which cannot always be eliminated even after restoration of a potential of a gastrointestinal tract. Two forms of acute intestinal obstruction are known: dynamic, resulting from a violation of a motor function of the intestinal wall, and mechanical, when are mechanical obstacle to the passage of the food through the intestinal tube. Dynamic intestinal obstruction, in turn, is divided in two types: spastic, resulting from a sharp spasm of a separate section of the intestinal wall, for example, reflex spasm during the passage of a stone through the ureter; paralytic, which is most often the result of neurotoxic influence and complicates any serious disease such as peritonitis. In medical practice, more often you have to deal with spastic intestinal obstructions. Mechanical obstruction is divided in two types: obturational and strangulational. With obturational obstruction, a blockage, obturation of the intestinal lumen occur, most often from the inside, and the blood circulation of it is not disturbed. Obturational obstruction occur with such disorders: tumor of the intestine, cicatricial narrowing of the intestine, blockage by a gallstone, ascariasis due to a tangle of roundworms. With strangulational obstruction of the intestine, the lumen of the intestine is closed from the outside, and at the same time a violation of a mesenteric circulation occurs with compression of a larger and smaller section of the intestine, which often ends in necrosis. This is the exceptional danger of strangulation obstruction. Strangulation intestinal obstruction includes such disorders: all types of strangulated hernias, volvulus, node formation, adhesive disease. The clinical picture of intestinal obstruction is very diverse and depends on the immediate causes is caused by obstruction. Past most often observed abdominal pain, vomiting, retention of stool and gases. Abdominal pain due to intestinal obstruction. Usually the pains are cramping and very intense. At first, the pain corresponds to the part of the intestine where the obstruction occurred. A fragment of the intestinal loop, strangulation, obstruction of the lumen by a tumor. Only after a while the pain becomes diffuse and spreads through the abdomen. Particularly severe pain is observed with strangulational obstruction, nodulation, twisting, infragment. The pain is so severe that patient quickly falls in the state of a shock. Vomiting in intestinal obstruction. Another important symptom of intestinal obstruction is vomiting. The higher closer to the stomach obstruction is, the sooner and more often vomiting occurs. With obstruction of a lower section, for example with cancer of the rectum, vomiting may not be. Initially, the vomiting contained food debris, when vomiting appeared with an admixture of bile. Stool and gas retention, intestinal obstruction. The main symptom of intestinal obstruction is the retention of stool and gases, which is accompanied by increasing bloating. The retention of stool and gases can be complete, and then bloating of the abdomen increases very quickly. Vomiting appears early. In low bowel obstruction such as rectal cancer, stool retention is observed for a week or more. At the same time, patients feel a strong desire to empty the intestine, but they do not succeed in this, even after taking laxative and trying to set up enema. In the early stage of intestinal obstruction, when peritonitis has not yet joined it, the abdomen is soft and palpation. Soreness is determined through the abdomen, which is intensification over the place of obstruction in the intestine. Auscultation of the abdomen is of great importance for the diagnosis of acute intestinal obstruction. In the initial period of a disease, increased peristaltic noises are heard, often coinciding with cramping pain, rumbling, gargling, sonorous noises with metallic tint, the sound of falling drop, with jerky pressure on the anterior abdominal wall during auscultation, and often without it, splash noise is determined, which occur to the shaking of the fluid accumulating in intestinal loops. When complete absence of a sound during listening, deadly silence, is a formidable symptom indicating paralytic ileus or peritonitis. Treatment and tactics of intestinal obstruction. Patients with suspected intestinal obstruction required urgent hospitalization in the surgical department, and as a rule are subject to surgical treatment. The result of the operation is directly dependent on the timing before the operation. Transportation of a patient with intestinal obstruction is performed lying on a stretcher. With several vomiting and signs of intoxication, patients are transported with a probe in the stomach. They are given intravenous drip infusions. Thank you for your attention. This material was prepared on the basis of material from All Scientifical. Attention, this material is for informational purposes only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.